Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Team Association. Last week I was in San Francisco giving an all-day presentation for Dental Team Day to the CSPD. I had over 260 plus people in the room, including about 20 or 30 doctors, and we were talking about basic communication skills and how that relates to risk management and communication within your office and how the parents feel about that communication. So one of the things we talked about was the fact that our parents and the caretakers don't know how good a job we did on our fillings that we put in. They don't know if the margins were great on that filling, and they don't know how that crown fit. So they evaluate our skills based on how we deliver the care to the child. Did we do it with compassion and concern and the best utmost care that we could? They're also looking at how do we communicate with each other. So they are evaluating how the doctor talks to them, how the team talks to them, how the team talks amongst themselves, and how the doctor talks to the team. So they are looking to see if we do it with respect, in honesty, in compassion. So know that they are always listening, even if it appears they're on their phones on Facebook, right? Think how many times you've been somewhere, a store or a restaurant, and you hear the team kibitzing amongst themselves and usually grousing about something and complaining about something in their work environment. Well, you don't want that going on in your office, so make sure that everybody knows that that's not acceptable and be aware that they're always listening. Another thing they do to evaluate you and your skills is the decor of the office. So they recommend that you change up your decor and refresh it every 5 to 7 years, and certainly no longer than 10 years. So if it's been longer than that, it's time for a refresh in your office and have it look much more current. Because if it's not, they're going to start questioning whether your office is up to date with the latest technology. How about the latest equipment? Are you giving them the very best care that is out there? So make sure your decor of your office represents how wonderful your office is and how up to date you are and how great the care is that you give their children. So another thing they are evaluating is the attire and hygiene of the doctor and the team. So it goes without saying that everybody needs to have a daily shower or bath and deodorant and very little perfume if at all possible. But how about how they look? If you have your clinical team in scrubs, then doctors make sure that they are dressed alike and get them tailored. Have the pants hemmed so they're not dragging on the floor, and have the scrubs themselves tailored to each individual. And then if you have your admin team in a separate outfit, it would be nice if they had a matching blouse or shirt that is the same color as the scrubs of your team. And certainly put their logo on it and make sure that the name is either on the scrubs or there's a name tag that they wear and the admin team wears, because the parents and caretakers want to know who it is that they're talking to. So make sure that's easy for them to see. And last but not least, one of the biggest things they are evaluating is the cleanliness of your office. I asked the attendees when I was talking to them how many of them have a cleaning crew that comes in every day, and lots of hands went up. And then I also asked how many had a cleaning crew once a week, and more hands went up. So then I asked how many times they come in the morning after they were there and they look around and they don't think that the cleaning crew did such a good job. And every hand went up. It is amazing how poor some of the services that you pay good money for actually are. I asked them if it normally is on the counters where the cleaning crew does not even move the things that you've got on your counters and clean behind them. They usually just wipe around them. Those things are quite noticeable, especially to an eagle eye of a parent, and they're looking at those things. They're going to be looking at the ground around your dental chair. They're going to be looking at the cabinet underneath the hoses where they hang. They're going to be looking at the dental light. They're going to be looking at the lights in the ceiling. And if you have those fluorescent lights that seem to attract all the bugs, literally overnight after you just cleaned them, make sure you are addressing that every day, because when they look up and see dead bugs up in the fluorescent lights, not such a good feeling. They're going to be worried if your office is not looking spick and span in the areas where they are allowed to be. They're going to wonder how things are back in the sterilization area. How about where the equipment is? Is everything clean and sterile like it's supposed to be? And you don't want them going down that path for sure. If you're like me, a lot of my classmates in dental school worked in restaurants, and how many times did you hear from them that if we saw what went on in the kitchen, we'd never eat out? I guarantee you some of the parents have heard that same statement, and you do not want them thinking the same thing about your office. So office cleanliness and the cleanliness of your entire team are important to the parents and caretakers in our practice. So in order to help you with that, I have an office cleaning checklist that I'm going to provide for you with no strings attached. I promise, no fooling, no strings attached. Just click the link in the email that this video is attached to, or you can just email me at pdtadirector@gmail.com. That's pdtadirector@gmail.com, and just ask for a copy and I'll send it right to you. You can download it, and it has what needs to be done daily, weekly, monthly, quarterly, and annually. And it's all spelled out, and you can check it off as it gets done. So docs, there's no stress on you. Give it to your team to take care of, and you know that your office then will be spick and span, and the cleanliness of your office will not be raising any red flags for any of your patients and their families. This has been your Practice Pro from the PDTA, and I'll see you on the next one.